three core design surgeons, Dr. Florin, Dr. Wright, and Dr. Zuckerman, all three were very like-minded in the sense that if you're going to create new medical devices, you need to make sure that they work, and the only way to make sure they work is to collect data.
This started off as just this little kind of smattering of data points.
It's incredible what we're just kind of seeing the tip of the iceberg that we can do with this. Without that database, that would not have been possible.
It's a monstrous data set that it has the capacity to teach us more than we even understand that it can.
Got approval to collect data before we even launched the product, and we enrolled every patient from the beginning.
And everybody knows that the strength of your conclusions in research is based upon the number of patients in your database, right? Because then it's much more robust, it's much more reliable. And we have that now. So when we report the results of a specific outcome for an anatomic replacement or reverse replacement for a specific diagnosis, we're not reporting 30, 40, or 50 patients. We're reporting 300, 400, 1,500, 2,000 cases.
We can ask questions that we could never ask before because you never had enough numbers or enough power to answer those and answer those in a reasonable scientific manner. Now we can.
It's been a very evidence-based way to practice and change my practice as I've learned more about it through the system and the database.
We'll take these answers and change what we do. Change the implant, change how we do the implant, change our surgical approaches, change our rehab.
The thing that I think is really important about it is that it's not overwhelmingly technologically heavy. It sort of runs in the background and makes it easy for you to do what we go to work to do, which is take care of patients.
The more we can improve things based on what we've learned from past experience, the more we'll be able to avoid obstacles and create excellent outcomes for the patients that we want to treat.
I want a reason when a patient asks me why I'm doing something, and I want data to back that up. I want to feel good about providing an answer and having solid backing for that.
What gives me trust in the company is the data, and that we've got the longest data in the industry, so we know what our outcomes are. And that gives me confidence that I'm putting in the best implants in our patients.
All that powerful data to support the implant results, there isn't any other implant out there that has that. So the device itself is fantastic. It's the implant that I have trusted for my patients for quite some time, but the trust continues to be reinforced because the data supports it.